Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I'm also the medical author of the books Focus Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. So we are continuing with the series of neuroimaging concepts. So today we are going to discuss diffusion perfusion mismatch. Diffusion perfusion mismatch neuroimaging concepts part 13. So basically the diffusion perfusion mismatch is useful to pick up ischemic penumbra. So the diffusion perfusion mismatch sequence is useful to pick up ischemic penumbra. And why is it important to pick up ischemic penumbra? Because this ischemic penumbra tissue is salvageable. We can treat it. We can thrombolyze and salvage the tissue. So what is basically this ischemic penumbra and the diffusion perfusion mismatch? When there is a decreased perfusion to the brain, a certain area gets completely affected. It is known as infarct. But the surrounding tissue, though there is a decreased blood supply, it is only ischemic and it is reversible. So this reversible ischemic tissue, we call it as ischemic penumbra. And then surrounding the penumbra is normal tissue. So basically there are three regions when there is lack of blood supply. So when there is decreased blood supply, the central part gets affected a lot, resulting in the necrosis or the death of the tissue known as infarct, which is irreversible by and large. Surrounding the infarcted tissue, we have an ischemic tissue which is reversible, what we call as ischemic penumbra. When we thrombolyze, it is salvageable. Surrounding this ischemic penumbra tissue is the normal tissue. So how can we pick this up by MRI sequence? So when there is a decreased perfusion, the central part gets affected, infarcted. But the surrounding tissue also gets affected, but it is reversible. So there will be perfusion deficit, the central area. The surrounding area also it is picked up on MRI, which is reversible but ischemic, which is known as a diffusion deficit. So there's a mismatch between the perfusion, the actual deficit, and the diffusion where there's an ischemic but reversible tissue. So when there is diffusion perfusion mismatch, we get the ischemic penumbra which is salvageable. So if we can see this diagram, this imaging, we'll be able to understand it better. So here you can see this is the completely affected tissue, the infarcted tissue. There is absolutely no perfusion and it results in complete death of the tissue known as infarct, almost irreversible. So this is picked up by again this sequence, and when you do this diffusion scanning, it is still bigger. You can see this is still bigger. So here it is still bigger. So this is the diffusion deficit. So it includes both the infarcted tissue and the ischemic core. So this is the surrounding ischemic core. So if you can compare the sequence given the B, which is completely affected, that is the perfusion deficit, and with the sequence in the D, which is a larger, this is a diffusion deficit. So when you subtract this diffusion from this perfusion, you get that ischemic penumbra which is salvageable. So here you can see in the diagram B, there's an acute occlusion of the proximal segment of the right middle cerebral artery, producing a region of signal abnormality on diffusion weighted imaging B. that is matched in size by an area of reduced blood flow C. This area represents the infarcted tissue. The area of prolonged transit time D. So here you can see it is a much bigger area, so which indicates that there is a prolonged transit time. So this area of prolonged transit time affects a larger territory, particularly posteriorly. So you can see here, this is posteriorly, there is still a bigger territory as compared to this. So here it is only this much deficit. This is known as perfusion deficit, but if you see the diffusion posteriorly also it is affected. So the difference between this territory, and the infarcted tissue, so this is the infarcted tissue, represents the ischemic penumbra and is often referred to as the diffusion perfusion mismatch. So why is it important? The ischemic penumbra is salvageable. So when a person comes with ischemic stroke, we always see how much ischemic penumbra is there, how much it can be salvageable by various modalities of treatment like thrombolysis. So this is a very important sequence, especially when we are considering thrombolysis. So these are the important concepts of the diffusion perfusion mismatch. The other important concepts of clinical neurology, especially the exam oriented clinical neurology, I put in a book called Exam Oriented Clinical Neurology. I am the author, Dr. Sreenivas, for this book. This book will be very useful for students appearing for clinical neurology exams. The other book I've written is the Focused Neurology book. I am the author, Dr. Sreenivas. This book contains all the essential concepts of neurology, so it will be very useful for students appearing for neurology Viva exams or oral exams. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. So these are the important and interesting concepts of the episode Diffusion Perfusion Mismatch. So if you have liked it, please share the link, but please subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and also my web page, Dr. Sreenivas Concepts. Thank you.